I'm Lisa Yen, Director of Programs and Outreach for the Neuroendocrine Cancer Foundation, and I'm here in Krakow, Poland with Dr. Thor Halfdanarson at the European Neuroendocrine Tumor Society Congress. And Dr. Thor, thank you for joining me. I know we've been listening to some amazing research and trials. What is one of the highlights for you?
So this has really got an interesting conference. So I think the one of the highlights has to be what I think is the first phase 3 clinical trial initially presented at ENETS, which is the compete trial of lutetium-177 DOTA. So this is not the usual PRRT, which is lutetium-177 DOTA, balsarum's Lutathera. This is DOTA. So a similar PRRT to the regular lutetium in patients who mostly had received previous therapy and were mostly grade 2, they were randomized to 4 cycles of lutetium-177 dotatate every 3 months. So also a little different from the Lutathera versus everolimus or afinitor, as you may know it as. And this trial showed without any doubt that the PRRT is more effective. Can't say this came as a surprise. We've known what everolimus does for years. It's an effective drug, but it's not quite as effective as PRRT is. And now we had direct comparison with 300 patients. Today, I think, is probably my key takeaway. There have been a lot of other and interesting studies presented. There was a smaller study of PRRT versus sunitinib for pancreatic nerve tumors called octorandom that also showed improvement in what we call progression-free survival in patients receiving PRRT. We've known these data. They were presented 2 years ago, but this is just a more mature, longer follow-up. So exciting times for radioligand therapy in patients with NANETS.
Yeah, really exciting. So you're saying that that trial, the COMPETE trial, showed that PRT is more effective than everolimus.
It is in terms of improving what's called progression-free survival. Keep in mind, progression-free survival is really the time from starting the treatment until the tumors grow. So what they do is that they had about 100 patients receive everolimus, about 200 patients receive a PRRT, and then they just start the clock, and then they see how long can they go on average until the tumors grow, and they follow certain sort of strict criteria, what constitutes growth. They follow these strict criteria, and they showed that the PRRT clearly had a longer progression-free survival. So it is more effective. What we don't really know yet is the overall survival. Will people necessarily live longer? I'm not sure if they do, as long as you ultimately get PRRT. So I'm not saying it's wrong to start with everolimus, but if you ask me, so what would be the most effective or more effective of those two, everolimus or PRRT? Well, in terms of progression-free survival, I would have to say PRRT because that's what the data just showed today.
Yeah, so progression-free survival, meaning a longer vacation per se, without having to worry about going to the next treatment.
Exactly.
Yeah.
Exactly. And 4 treatments, 3 months apart. So that I think is worth something.
Yeah. So patients want that, those longer vacations, longer time without having to worry about the next treatment. They also want to live well. So what did it show in terms of that?
So we still don't have the full quality of life outcomes. But we saw from the other studies on the operandum that the quality of life was actually better, at least some aspects of quality of life in the patients thinking were getting PRRT compared to those who got sunitinib. So I think we'll have to wait for the final publication. These are better data, but I'm eagerly waiting for the final report where I can really look into the quality of life data. I'm hoping there will be some patient-reported outcomes as well.
Yeah. Yeah. Okay. So we're waiting for that data. What about side effects?
Side effects, nothing new. So all of these are side effects we knew from PRT. Can lower your blood counts. Severe side effects like leukemia and myelodysplastic syndrome, thankfully, are really uncommon. So no more common than we previously have seen. Everolimus is a well-known side effect profile. So nothing new, no new safety signals. So both drugs, I think, performed as expected with side effects, but one was superior to the other. with progressing through survival.
Yeah. Okay. So key takeaway that you want the patients to know from that.
So key takeaway would be from this trial is that the PRRT seems to be more effective than the everolimus in terms of progression-free survival. But everolimus is still a good option. So will it ultimately matter if you get PRRT first and everolimus later, or sunitinib or cabozantinib or what have we? I think as long as all of our patients get all of our available effective options, well, that's really what we should try to do.
Thank you, Dr. Thor, for sharing your thoughts about this trial, and thank you for being here and for all you do on behalf of the NET patient community.
Likewise, thank you very much. We could not do it without you.